Dialysis is a process for removing waste and excess water from the blood and is used primarily as an artificial replacement for lost kidney function in people with renal failure. Okay, so what that means is that the kidney's job is to filter the blood. That's its job, to filter blood, to remove the waste and excess water from the blood. People who are in renal failure, their kidneys are failing to do their job. They're failing to filter the blood. So all of that waste just recirculates in the blood. And over time, that is very toxic to the other organs of the body and can cause lots of problems. So hemodialysis, so this is something where this is a lifestyle change. If someone is on hemodialysis, for the rest of their lives, they have to go to a hemodialysis center, 2, 3, sometimes 4 or 5 days a week for a certain amount of time to have their blood cleansed. And this is, kind of what it looks like. Here's the hemodialysis machine, and then they have to get hooked up to it for every visit, which again could be several times a week. So in order to access their blood, because again, they have to be accessed several times a week, so in order to do that, there are three kinds of vascular access. The AV fistula, which means arteriovenous fistula, and a fistula is an abnormal hole. In this case, this is a surgically created abnormal hole. The AV graft, arteriovenous graft, which a graft is just another name for a synthetic tube. And then there is just the plain old central venous catheter, and this is more of a temporary solution until now the fistula and graft, these are permanent solutions. The normal venous catheter is a temporary solution until the patient obtains a fistula or a graft, and sometimes these can take several months up to a year for these things to occur because it's a surgical procedure and then they have to heal properly and so on and so forth. So until that process happens, a lot of times people will just get a central venous catheter, and that catheter can be tunneled or non-tunneled. Of course, all of these access sites are vulnerable to thrombosis, which is a blood clot, intimal hyperplasia, that's overgrowth, where the blood vessel tries to heal itself and causes overgrowth. So dialysis patients must be continually managed and their access sites continually managed with thrombolysis, thrombectomy, angioplasty, and stent. So here's a document I found just online, and what it is, it's a patient, information document, and it does a really good job of just explaining what hemodialysis is and what all it involves. So I won't read the whole thing, but I just want to highlight a few things. So again, one of the important steps before starting regular hemodialysis is preparing a vascular access, which is the site on your body where blood is removed and returned during dialysis. So if the patient, again, is in renal failure, the kidneys aren't filtering like it should, then dialysis is the process of removing that blood, having a machine clean the blood, and then returning that blood back to the patient. There are three kinds of vascular access: the AV fistula, the AV graft, and the venous catheter. The AV fistula is considered the best long-term access. So that's where, again, a surgeon takes an artery and a vein, usually in the forearm, and surgically attaches it to create a fistula. So this talks about, what a fistula is, an artery vein connected, and then this kind of shows you what it looks like. So again, it's an artery and vein surgically connected, and then there's usually 2 needle sticks. So this one would be to take the blood out to go to the dialysis machine, and then this would be for the blood to return to the patient after it's cleaned. Okay, then there is the AV graft, which again, a graft is just another name for a synthetic tube. So right here, synthetic tube or graft. And so instead of directly connecting an artery and vein, they just add in another piece. This is just an extra step, basically, is they still are connecting an artery and vein, but they're using this piece of graft material to connect it. So sometimes if the arteries and veins are maybe too small to be surgically created, sometimes they have to add a piece of graft. And then there is the venous catheter or central line. And again, this is more of a temporary access. And this is, what it could look like. And again, these temporary catheters could be tunneled or non-tunneled. Now, if it's an emergency and the patient needs hemodialysis like now, they probably won't take the time to tunnel it. They'll just get the access and do the hemodialysis. But again, while their AV fistula or AV graft is being prepared, sometimes they have to keep these temporary catheters in for weeks up to months. And so if that's the case, then they would probably go ahead and tunnel it, and that means to create a tract underneath the skin. Every hemodialysis session using a fistula or graft requires a needle insertion. And then possible complications. The most common complications are access infection and low blood flow due to blood clotting in the access. So again, and then this goes on to say that the graft may require angioplasty, and of course it could require several different types of interventions. But I just wanted to share this article with you. I thought it was just very informative. It was more of a patient guide, patient information document, but I thought it was very easy to understand, so I decided to share that with you.